What's the best restaurant in the city?
So one of my favorite restaurants is Winona, which is a restaurant in the east end of the city, not too far from where I live. It's farm to table, small menu, but beautifully prepared foods. If you ever go there, try the grilled focaccia with the olive oil they give. Delicious.
Can you tell us about the OurCare research?
So we set out to hear from patients and the public about what mattered to them in a primary care system. This was the largest ever pan-Canadian engagement of patients and the public about the future of primary care in Canada. We heard from almost 10,000 people over 16 months, first through a national survey, and then through some deep dialogues. First, a series of 5 priority panels, and then 10 community roundtables. In these priority panels, people spent almost 30 to 40 hours talking to each other, learning about primary care from experts, and then thinking about what it is that they want to see in a better primary care system, and really coming to consensus among the group with these strangers that they had actually never met. And then in the roundtables, we did one-day dialogues with members of underserved groups, people who are often marginalized and whose needs are often not met and whose voices are not heard, people from Indigenous communities, Black communities, newcomer groups. And we conducted one-day sessions to understand what their experience is like and what they wanted to see. And what was remarkable is that despite the diversity of people we talked to over the 16 months, there was a lot that they could agree on. And what we've done is we've summarized all that we learned, and we've distilled their wisdom into something we call the OurCare standard. 6 simple statements that basically summarize what every person in Canada should be able to expect from the primary care system. And I'd urge our viewers to go to OurCare.ca to take a look.
Awesome. And what excites you about the OurCare research?
I'm excited about a few things. First is that we've put forward a patient and public-centered vision for the future of primary care, and I think it's a vision actually that many different groups can agree on, whether you're a researcher, whether you're a policymaker, whether you're a professional. I think that these OurCare standards are things that are going to be resonating with you. I'm also really excited, though, about just engaging patients and the public in shaping a better future for ourselves. And so one of the things we've done with our website is make it really interactive so people can take a quiz and see, how does your care compare to our care? How do the provinces measure up when it comes to the OurCare standard? And most importantly, we're actually encouraging people to write to their elected representatives to tell them, what is the kind of care that they want to see.
Awesome. What makes Unity Health a great place to do research?
So I've loved working at Unity Health. I've been here since about 2011, both as a family doctor and as a scientist. I'm really drawn to the core values that we have here at St. Michael's and at Unity Health to serve the sick and the poor, and to serve the most marginalized. I'm so lucky to work with colleagues, both clinically and in the research sphere, who have the dedication to serve us and who inspire me every day with the work that they do.
Awesome. And what's your hope for the future of OurCare?
We're calling on governments across the country to adopt the OurCare standard as the way forward. And I am really hopeful that OurCare is going to be setting the direction for the next 5 to 10 years about where we're going to go into the healthcare system. I'm hoping that 10 years from now, we'll have almost every person in Canada have a family doctor or primary care team, that team will be connected to community and social services and be able to address overall well-being, that patients will be empowered, know how to navigate the system and have access to their own health record, that they'll be able to get timely care, all the care that meets their needs, culturally safe and appropriate care, and that ultimately primary care in the health system will be more accountable to its communities.